Hello, I'm Dr. Raj Pusuluri. I'm a physical therapist, and here with me today, Dr. Ryan.Perron, physical therapist as well. In this video, we are going to talk about hip pain and what are the causes of hip pain, what are the signs and symptoms, and how to treat hip pain using physical therapy modalities, without using medication. That's the goal of this video. Let's first talk about the causes of hip pain. Ryan, what are your experiences? What are your thoughts on causes of hip pain?
Yeah, a lot of the hip pain that I am working with and dealing with my patients are arthritis. One of the big ones with that, and how we treat it and whatnot is different for different types of causes. But sometimes hip pain can be from like an overuse from the type of job or situations that people do repetitively over and over. It can cause kind of an overuse. Sometimes muscle tightness, there's weakness. We have other things that we deal with, hip pain from a fall,
Right.
and then sometimes the joint replacement itself is another big one too.
Yeah, great. Yeah, those are the three major, causes usually that we know. There may be some other genetic related, people that
Mhm.
are born with some deformities in hips. That's a different, cause. But we do see some people with the genetic deformities. Um, so the next topic is the signs and symptoms. What are the signs and symptoms of hip pain? Most people, what is your experience?
Yeah, when symptoms like with the arthritic pain, a lot of times first thing in the morning, it's stiff, it's tight, it hurts, and then they talk about that after they just kind of warm up, some of that motion is lotion, they mention, and
Yeah.
just eases up a little bit. And then towards the end of the day, it's kind of that achy, deep feeling pain again, and the weight bearing, standing on it, really bothers it. And so those are a lot of the symptoms with kind of the arthritic side of it. And then, of
Okay.
course, those that have a hip replacement, they got the pain from the surgery interventions, and that can be kind of a more of a sharp pain, but
The sharp
that's
shooting
only
pain.
temporary though. Once they get the hip replaced, yeah.
Right.
Hmm.
Yeah. Um, so how can we talk about how we are going to treat those different types of pain
Yeah.
using without using medication?
Hmm. Yeah.
Sorry, my
Yeah.
son is.
Yeah, that's awesome. Yep. Yeah, he's gonna have a great teacher there. Yeah, with the hip pain, like with arthritis, it's got to be approached differently than other types of recovery, like from a hip joint replacement versus arthritis. Because I find with arthritis, you got to go by what it tells you. You know what I mean? I personally avoid numbers like, okay, let's do 3 sets of 10. When we're trying to work with arthritic pain, I say you just got to listen to it. When it tells you, okay, enough is enough, you back off of it with those approach. And so, that's what therapy can help you with. Is the right direction and the right path to be on based on the diagnosis that you have. So it's not a cookie cutter approach.
Okay. Um, so any what about the sharp shooting pain? How to address the sharp shooting pain?
Yeah, so a lot of that, look, modalities are out there. A lot of times the ice is the go-to if we kind of want to know, is it heat or ice? A lot of times you can't go wrong with the ice, and the ice
Right?
is a good one to start with.
No side
In the
effects.
therapy,
You can use multiple times a
yeah,
day.
that's what you have at home. You've already got that. And then in a therapy setting, they'll have moist heat, they'll have a TENS unit, they'll have diathermy, ultrasound. So all that depends on what, like I said earlier, the diagnosis, and that the therapist will know which was the right one that's appropriate for their patient's individual circumstance.
Right. Yeah, great. One thing I do want to, talk about is for physical therapy, especially positioning of the hip,
Mhm.
especially after the surgeries. Can
Yes,
you
yes. Well,
can
yeah,
you
like after a joint replacement, yeah, positioning is a very important one. There's depending on the approach, if they do the approach to get to the hip from the front of the body to the side of the body or the back of the body, there'll be different precautions. And
right,
those precautions are there is because they had to dislocate the hip in that position. And so the individual wants to stay away from that position. And the physical therapist is there to help remind them and make sure they're compliant with that precaution. But yeah, that positioning is an important one. Mhm.
right, yeah. And especially the surgeon gives a clear, specific precautions for each patient. It can be different for each patient, but most commonly, no bending of the hip more than 90 degrees, no crossing legs, or no turning the toes in. These are the three precautions that we hear most commonly. But there can be other precautions based on the surgeon's decision approach the surgery. And obviously, there may be sometimes non-weight bearing precautions. That's another thing the patient has to be very careful about. Um,
Yes. Mhm.
yeah. So we talked about the causes, we talked about the signs and symptoms, and we talked about how physical therapy can help. Is there anything else that we can from your personal experience that you felt very good suggestion from the patient, or that you felt you gave a very good suggestion to the patient?
Yeah, I think one of the biggest thing is, especially after surgery, your body, the joint is good; it's ready to go. And so a lot of people will have the feeling like, oh, it's going to break underneath me or whatnot. But I like to tell them, learn to trust it. As you do things in the recovery, learn to trust it, but you trust it what you tolerate. And so
Right.
go by what you tolerate. Don't try to compensate or avoid it, but just learn to trust it. Learn to, but that's best approach is by tolerating it. And then as
Yep.
you repeat it, your body starts to get the idea. And that's what the role of the therapist is there to do, is making sure you're doing it the right way, not just what you do.
Right. And
Doing it is going to be the best direction. Mm-hmm.
yeah, I totally agree. When after the surgery, during the surgery, actually they use the bone cement, and it's a two metal parts. So there's no way we can, you can detach it, dislocate it. However, in some situations, if patient falls or if there's a blunt force, I've seen some patients, dislocate, but that's very rare situations. For
Mm-hmm.
most people, the joint is solid and cement, nothing. You just have to be cautious about infection. If you take care of, preventing infection within, 6 to 8 weeks, most patients pretty much do what they want with few limitations.
Right. Yep.
Yeah, I think that concludes our video today. Thank you very much, Ryan, for your time and giving me
Of
explaining
course. Yeah. Yep. And
how to
we
treat the
thank our special guest with us that came in today.
yes.
That's great. I
Thank
love
you.
it.
Thank you, Ryan.
All right.
Bye bye.